You know what's funny, Jennifer? It's just that we haven't come up with a good alternative agent that's anti-inflammatory yet, but there's a few things on the horizon that are now emerging.
Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome to episode number 76 of the Healthy Skin Show. In today's episode, we're going to be talking all about acne, Accutane, and antibiotics that sometimes are used to help people deal with their acne. Today's conversation went pretty long, so I want to dive straight into my interview with Dr. Raja Sivamani. Hello, everyone. Welcome back. Today, I have a very special guest with me, and this interview, to be entirely honest with you guys, has been a long time in the making, like months and months and months. And so my persistence has finally paid off, and I have gotten this doctor here to talk to you today. And I'm really excited for us to dive into some of the information about medications that can be used that then can play a role in disrupting the microbiome in the gut, on the skin. I think you guys will find this very, very fascinating. His name is Dr. Raja Sivamani. He's a board-certified dermatologist and practices at Pacific Skin Institute. He is an adjunct associate professor of clinical dermatology at the University of California, Davis, and director of clinical research and the clinical trials unit. He is also an adjunct assistant professor in the Department of Biological Sciences at the California State University, Sacramento. He engages in clinical practice as well as both clinical and translational research that integrates bioengineering, nutrition, plant science, cosmetics, and skin biology. With training in both allopathic and Ayurvedic medicine, Dr. Sivamani takes a holistic approach to his patients and in his research. And so, long story short, Dr. Sivamani knows his stuff. He knows a lot of stuff, and I am so glad that he could join us. Thank you so much for being here.
Oh, Jennifer, that was such a wonderful introduction. You got me a little red, actually, from saying all those things. But I'm really excited to get on and talk to you about, all skin-related topics. I think there's so much that we could talk about, so I'm excited to spend some time with you.
Absolutely. So we were talking before this interview about the connection between certain drugs and how they could potentially throw off the microbiomes. We'll put that in plurality because there are microbiomes in the body. And, the one that you brought up, I think, which would be a great place to start, would be with the product called Accutane, which has a lot to do with acne. I get asked a lot about acne. So can you talk to us a little bit about what the deal is with Accutane, or was, I guess, because you're saying it's actually not Accutane anymore. That's not how people would call it. And how exactly would that disrupt or change the microbiome of your skin?
Well, this is a really interesting topic because isotretinoin has had, either it elicits a really visceral bad reaction in a lot of folks, or it elicits a good reaction in some folks as well, believe it or not. But to start with, yes, Accutane was the brand name for isotretinoin. And so that brand name doesn't exist, but the branding was so strong that many of us still call it Accutane. But the actual brands now that basically give it's the same medication, isotretinoin, the names have changed. So your doctor might call it isotretinoin. But to go to what you're saying, I do a lot of work on the gut-skin axis, and we look at things like nutrition, long-term effects of antibiotics, how can we reduce antibiotic use? And so this is where isotretinoin really comes into play. So, save it to more directly answer your question on how does isotretinoin affect the skin. It's pretty interesting. Isotretinoin has this ability to have a prolonged change in your skin, in that we know that if people take isotretinoin, it's one of the few things in medicine, especially the Western approach to medicine, a lot of the medications are symptomatic care. They still will change trajectories of health, and they can change cardiovascular risk. They can change diabetic risk, if you take medications. but there are few things that you take and then for a temporary bit of time, then you take away and the disease is changed forever. And isotretinoin is one of those few ones where if you take it for a short burst of time, and we should talk about this because there are different nuances to it. It's not everything that you read online, but you take it for a short period of time, you can actually potentially get rid of your acne forever. And, just even saying that is kind of mind blowing. So, it does shift. We've been doing research on isotretinoin. It does shift the way your skin's, what we call fats, lipids on their skin are being expressed. And in doing so, it shifts the inflammatory profile on the skin. And in fact, it will shift the microbiome. And, there's some early studies looking at that. But, we need to do more studies to understand exactly how that shift occurs. But we know that it definitely shifts the lipids on the skin, and lipids act as foods in many cases for the skin's bacteria. So that is one of the ways we know that isotretinoin is working.
Do you feel, though, that it also has some sort of impact on the microbiome of the gut as well?
That's a really great question. And maybe to answer that, I can take a step back and say one of the things that we give for acne commonly, if you go to most, I could say, physicians, especially if they're MD, DO trained, one of the things that is classically been a really common medication is antibiotics. Mm-hmm. And antibiotics are life-saving when you have an infection, but they also have this anti-inflammatory role, and they work really well for acne. And so that's usually one of the first things that's given out. We now know that even short-term exposures to antibiotics do shift the gut microbiome. Now, that in and of itself doesn't necessarily mean that's a bad thing, especially if someone's struggling with acne and struggling with bullying or struggling with psychological issues, and you're able to get it under control. That obviously you have to balance things, but we're looking for different ways to treat acne. And, we can talk a tiny bit about nutrition and the role of nutrition too in all of this. And this is where Accutane comes in. So Accutane, especially if people have really severe acne, you're looking at prolonged courses of things like antibiotics, and we're trying to find other anti-inflammatories. But if you have really bad acne, it becomes a challenge. And that's where isotretinoin, when you give it to someone, you can really control their acne. Now, in terms of the gut microbiome, it's a great question. It probably is shifting the gut microbiome. I don't have specific data on the gut itself. The stuff that we've been looking at has been looking at more shifts in the blood lipids, which are the fats in the blood, and then also what happens at the skin level. But I wouldn't be surprised, and it's an area of ongoing study that we're even going to be looking at is what happens at the gut level.
Let me get this straight, because this is really interesting to me. When I was in high school, I took Tetracycline for my acne.
Yeah, right. So, actually, really common. That family of medications is very common.
Yes. And so fortunately, I was able to get rid of my bad acne with the Tetracycline and didn't end up down the Accutane route. But it's interesting that Accutane is affecting the lipids. And yeah, so for those of you who are listening, and I'm not entirely certain how much we discussed this on the podcast so far, but I call them bugs. But the bugs on your skin, actually, they thrive on fat. They thrive on the lipids. It's not like the bugs in the gut that love to eat fiber. It's a little bit different. And so is it possible that in shifting the lipid makeup of the skin microbiome, could that have negative impacts down the road?
I think this is a great question because it can have negative or positive impacts depending on your situation. And you're absolutely right. So when you look at the skin microbiome and you look at the Genome Project, when it was originally done, and they did a lot of mapping on the microbiome, a lot of the original work was in the gut, but then when they turned their attention to the skin, it was very fascinating. Every single part of your body anatomically will end up being slightly different. And so, we have a lot of what we call microbes, which includes, parasitic, and a parasite's such a loaded word, but you actually have good parasites that live on your skin. You have fungi, and you also have bacteria. and they're patterned on the skin in a very unique way. So when you look at the oily areas on the skin, so say the face, the upper back, the upper chest, by the way, the areas where you typically can get acne as well, we know that there's a different bacterial makeup of the dominant bacteria in those areas as compared to, say, farther down your arms or farther down your trunk, the lower abdomen, or if it's on your back or on your legs. And then if you look at the moist areas in between your toes, and I'm sure, many of us could do the whiff test and know that the bacteria there are probably different. But if you think about like the armpits, the groin areas, the in between the toe webs, especially when things can stay moist, the bacteria there are different again. And so, and the question is, well, so we now know there's a microbiome, but what's patterning that microbiome? Because just knowing that there's a microbiome isn't the full story. We need to know what's controlling the microbiome, how's the microbiome interacting, and how is it actually being nurtured at the skin level. And it turns out, and it might not be the full story, but part of that story is the lipids that are on your skin absolutely serve as food or serve as a supportive agent for the bacteria that tend to be there. And specifically, if you look at the oily areas, because we're talking a bit about acne, the bacteria that's been long thought of as the culprit, and by the way, it's still not totally clear cut that it's the culprit. It was originally called P. acnes. They changed the name. The name is now, instead of Propionibacterium acnes, it's been changed to Cutibacterium acnes. It is very lipophilic, meaning that it thrives off of lipids. And so it's no wonder that it tends to be overrepresented, or I should say highly represented, in the areas of the skin where you have a lot of lipids. And so if you take any sort of a medication, whether it's, say, isotretinoin, there are other medications, though, that can also reduce lipids and reduce the change the profile. You're probably going to be shifting the bacteria on your skin as a side effect, or maybe it's your intended effect. And so there's definitely an interplay there between the microbiome and the lipidome, as we call it.
And is there any concern if somebody who's taking or has taken Accutane, you had mentioned that it shifts the lipid profile in the blood. Is there anything you have to be on the lookout for, you should keep in mind because most people are thinking it's just affecting their skin. And now what you're saying is, no, actually, internally, we're seeing this shift. Is there anything we should keep in mind as far as it shifting that plasma lipid makeup?
So it does shift the plasma lipids as well. And, one of the funny side effects, and I definitely take a very holistic approach because I, have an Ayurvedic background, and we have prolonged conversations about nutrition, supplements that have early evidence for acne. And then we also talk about, different lifestyle changes that people can do. Of course, when people go on isotretinoin, I think it'd be really good for listeners to realize that what you read online is all about high dose isotretinoin. There's actually a way to do it low dose, so it doesn't tax your system as much. But and that's a different approach. And if you can find a board certified dermatologist, they can definitely talk more about this. But one thing I will say with isotretinoin, it definitely will shift your lipids in the blood, and sometimes it will increase what we call the triglycerides, because isotretinoin is a class of medications called retinoids. It will increase the triglycerides in your blood. A funny side effect there, Jennifer, is that when I put teenagers on isotretinoin and we follow their lipids, it's amazing how quickly they cut out the fast food when they see that little blip. And they start eating right. It's a great motivator to get them to start eating better as well. From all the research that we're seeing, once you get off the isotretinoin, your lipids go back to what they were before.
Okay. Do you find that there are any downsides long term, that if someone had used this in their past and maybe now they're struggling with psoriasis or eczema or rosacea, is this something that they should mention to a practitioner that they're working with, that, hey, I actually did have a history of Accutane use?
Now, with one of the things that isotretinoin can do is it can typically shift how oily you are. And but that's usually only during the time period that you're on it, because once you come off of it, for whatever reason, You might not be as oily going forward, but usually when it comes to things like other conditions like psoriasis, actually, typically we use retinoids. Isotretinoin doesn't work that great for psoriasis, so usually that's not an issue. In terms of long-term impacts with isotretinoin, we don't see too many long-term impacts. Now, I do realize that when you read online, you'll get a lot of folks talking about mood shifts. There's a big controversy about inflammatory bowel disease, which has largely been disproven now because, as dermatologists, we're very concerned about, is there a link there? And it turns out that a lot of those folks that ended up getting the inflammatory bowel disease had confounding factors. So it's not that it leads to this long-term issue. We actually don't see too many long-term issues, although there's quite a bit of conversation around that. Even with things like eczema, maybe some folks might get a bit more drier on their skin in general, and they might have eczema that has flared. But, the truth is there are so many lifestyle effects that we just don't talk about, even with eczema, that there are very good ways to approach these. It's good to let your doctor know that you've been on isotretinoin and the previously brand name of Accutane, but we don't see long-term effects that affect people for a prolonged period of time that truly hold up with scientific studies.
And I wanted to ask you about tetracycline, since I was the one that mentioned that, basically. Yes. We should talk about that. Yes, definitely. Because it's very commonly used, and I believe from my research with perioral dermatitis that class, and correct me if I'm wrong because I'm not a doctor, but that class tends to be the one that is used for people with perioral, which is a real pain in the behind to get rid of.
It is.
So, any thoughts on tetracycline and using that with acne, or if you have any thoughts on perioral dermatitis too? I think that would be much appreciated by those who have that or are struggling with it now.
I love that you're talking about antibiotics. So the tetracycline antibiotics include the tetracycline was the antibiotic itself. That's actually not as available nowadays because it had a lot of GI issues. Now there's doxycycline and minocycline. And the new guidelines are to reduce antibiotic exposure so that you're getting people off within 3 months. Personally, and this may be really relevant to a lot of listeners, if you're an adult woman with acne, or you're a teenager that's female with acne, my first line no longer is actually antibiotics. Especially if you're in your 20s and 30s, there's a big hormonal component, and now they have different medications that can address that are non-antibiotic. But to go to your point about antibiotics, they definitely shift the gut microbiome, and we know that even a short-term exposure to the tetracyclines will shift the gut microbiome. Now, the good news is that at 6 months, it seems that there is largely a lot of recovery of the gut microbiome. And so what I tell a lot of my patients is to make sure that they continue to eat a lot of plant-based foods and fruits and vegetables. Try to get about 9 servings a week if you can. That's really important. And then secondly, having a probiotic on board has been shown to reduce people from developing things like vaginal candidiasis, like yeast infections. And so we know that if you can take the antibiotic with a probiotic, then that does not only become helpful for the side effects, but there are some specific probiotics. There was one specific probiotic that was studied in a small study that showed that it actually improved how your acne improved. It worked synergistically with the antibiotic. And the goal is to try to get people off these antibiotics.
Absolutely. So why is it? I guess my question is, what is it about the antibiotics that was just, we decided to use that in order to address acne? Is it that it is shifting the microbiome on the skin? I mean, obviously it's shifting the microbiome of the gut, but was that the intention? Were we realizing when that happened, like, oh, we probably have bugs in the gut that shouldn't be there, so let's take this medicine and look, our face clears up? Or is it more the anti-inflammatory aspect of the antibiotic? Like, just any thoughts that you have around that?
Yes, I think the credit for realizing that the gut had a role really can't go to Western medicine first. It has to go to traditional Chinese medicine and Ayurvedic medicine, because they've been talking about the gut for a long time. But in terms of the reasons we use these antibiotics, it's because it's not an infection. Some people think there's an infection in acne. It's the anti-inflammatory. And you know what's funny, Jennifer? It's just that we haven't come up with a good alternative agent that's anti-inflammatory yet. But there's a few things on the horizon that are now emerging. And so we've fallen back on antibiotics, and we didn't realize the unintended consequences that it was going to shift the good bacteria in your body too. Now, if you have a bona fide infection, absolutely, that's where antibiotics, no question, is super important. In an anti-inflammatory setup, I do think there's going to be other agents that are going to eventually come and replace the antibiotics. So if one of the areas that people are looking at now very intensely is different probiotics. And probiotics, it depends on the exact bacteria and the formulations. But I think there's some promising things on the horizon with probiotics that may eventually help us reduce the antibiotic use. But we're using it primarily for anti-inflammatory reasons.
And if someone's listening to this and they're like, okay, so if it's more anti-inflammatory, what are some recommendations that you have for patients in that boat then, maybe from like an Ayurvedic perspective, that they could take action on in their daily life that may also be helpful?
I think this is going to be fantastic because I always love to bridge the Ayurvedic principles into the Western principles. So, from a Western perspective, you just label it acne. And there are actually several subtypes of acne. You can have what's known as comedonal acne, which is a lot of plugged pores. You produce a lot of oil. So you get a lot of blackheads and whiteheads, what we call comedones. You can also get an inflammatory form of acne with what we call papules, which are those red bumps, pustules, which are, the pus-filled bumps, and sometimes these deeper, painful nodules. From the Ayurvedic perspective, the way Ayurveda looks at the body is slightly different, but actually it's really beautifully integrates with the Western approach when you start building these bridges. So the Ayurvedic approach is, just to break it down to the most basic approach, and this is, I'm giving kind of a rudimentary description. There are these three physiological energies that control how the body reacts, and they're known as the doshas. And so when someone has acne is not acne, neither from Western medicine, because there are nuances, but from Ayurvedic medicine especially. And the two doshas that are involved are known as Pitta and Kapha. Kapha is really relates to structure, the production of things like lipids and oils, especially when you start looking at how that correlates to the Western research paradigm. And Pitta is related to inflammation. So when you have these two doshas that are out of balance, we start thinking about things that might, not add to kaphic imbalance. Funny enough, it's going to be things that create an insulin spike. So the Ayurvedic approach is that anything that's going to lead to a kaphic imbalance would create an insulin spike. And so things like sugars, high glycemic index foods, and now we're starting to see there's a lot of epidemiological studies around milk, especially skim milk. All of these cause insulin spikes. And so you start to see these beautiful bridges going between the two different traditions that maybe they're not so different. Yes, the education and the way they approach the body is different. So, if you are totally trained in Western medicine and you're looking at Ayurvedic medicine, you might say, what is this? But actually, if you delve into Ayurvedic medicine, you say, oh my God, there's these beautiful bridges that actually come together. And so I definitely talk about diet. Now, is diet going to take someone with severe acne and make them totally better? No, it's not, but it's part of the equation. So, some of the things that I talk to my patients about is reducing dairy intake. I take them off dairy altogether. There hasn't been a prospective study looking at taking dairy away and saying the acne got better, but there's so many epidemiological studies showing that dairy probably has a role, that I'm very comfortable taking people off dairy because I know there are other nutritional agents that people can take. And also I talk about making sure that they try to have low glycemic index foods. So what that means is, stay away from the white breads or the quick, simple, refined sugars that come out of candies and whatnot, and try to go after the more complex carbs like fruits and vegetables. And a hidden area that people don't realize is when you drink these sweetened teas, they are loaded with sugar. And there was a recent epidemiological study that just came out of Asia showing that kids that drank more sweetened teas had a higher incidence of having acne as well. And so then there's all these hidden sugars that we have in our diet that I try to make a point to have people think about. And I definitely get people off dairy. It's amazing. Teenage boys, teenage girls, they are willing to stop dairy because the acne is so profound. And I think it also reduces the need for medications as much. And then the last little bit is a lot of folks are trying to put on weight, especially when you're in your teens as a male. A lot of people are going to the gym as a young male, into the early 20s, and some of them are struggling with acne. I get them off the whey protein because a lot of people are taking whey protein supplements. We always think, it's anabolic steroids or something, but actually whey protein has been shown in a couple case series, not a full study, like when they've taken them off the whey, their acne got better. And then when they put them back on the whey, their acne exploded again. And so it's something that I talk to folks about. And we've done research on the milk proteins, and we know the milk proteins do stimulate the oil glands. So I think, those are a couple of ways of bridging Ayurveda and Western medicine together to come up with a holistic conversation with my patients.
Wow. This has been such a good conversation. I feel like we could go on and on and on about this, but people love their 30 minutes. So
of course,
we let this conversation go. I let this conversation go on longer because I have thoroughly been enjoying it. And I hope that we can have you come back sometime because I'm sure that this is one area of your expertise that we can talk about, but there's likely many others. And I really want to share what you're doing as well, because I think it's of tremendous value to everyone who is listening. So whether you're a patient or you are a practitioner or you're more interested in the practitioner end of things, you started a website called learnskin.com. And that is geared more toward helping educate practitioners, correct? And looking at the skin from a more integrative perspective.
Yeah, we're really excited about learnskin.com. It was started by my wife, Vinita Sivamani, and then she has a group of dermatologists that she worked with. And I serve as a medical editor because I think it's really important to make sure that what people are reading is at least vetted and based on, medical literature, and it's based on scientific facts. As much as we want to talk about a lot of the potential for a role of multiple aspects and integrative approaches, I think it's really important to still be rooted in a scientific approach. And the whole principle of Learn Skin, we're very excited about it, is that we bring the information online, make it easy for people to access, and it's an integrative approach. And so it's not just an online approach, though. There's also the Integrative Dermatology Symposium, and the next one is we do it every fall, so you can go to integrativedermatologysymposium.com to learn more about that. So we have online classes, online articles, continuing medical education for folks that, especially from practitioners that want higher level content, and they can get their CMEs and have fun with it. And we're also putting on a lot of summits that are open to the public to come in, and also practitioners to come in, so that we can really have open conversations about how they might approach things with their patients. Because I think a lot of what we learn in medicine isn't just what we're reading in textbooks. It's from experience too, because there's a lot of gray area where it's really helpful to hear what other people are doing.
Absolutely.
And so we're trying to build that community.
And I think that's so needed right now because people want this information. They're tired of suffering. I suffered. I know what this is like. I was like, why doesn't my dermatologist understand any of this? Like, the only option she can give me is the steroid cream. Like, that just seems crazy to me in this day and age. So I recognize that part of it is there are so many other things, but we need to create a way for people to learn about it, because it's not, textbooks are written. Those textbooks are written, 2 years before they're published? I mean, the information is, and it's difficult to also keep up on research. It takes a lot of time, and you have to really want to be interested in it in order to do it. And I love the fact that you are, and that you're sharing that information to help educate about all these other options. And then for the consumers who are also interested in just looking at ingredients and understanding their skin from a different perspective, they can check out DermVeda. It's DermVeda.com, and that's a really great website with a lot of amazing information as well. So I think it's great that you guys are supporting both the patients as well as the practitioners, and together we're all helping to move this movement forward. I love it. So I'm just so appreciative that you were able to join us and we were able to figure this out, because this has literally been a conversation probably almost 8 months in the making at this point.
Yeah, it's definitely taken some time. And I can end by saying that, when you're thinking about your physicians and thinking about skincare, dermatologists are very thoughtful. One thing that dermatologists are becoming much more, and we've always thought about science and we've always thought about medicine. We're always thinking about what is the best evidence that we can find. So what dermatologists are doing is, as studies come out, our understanding and landscape is shifting. And so you'll find much more of the field now understanding that nutrition plays a role, that the microbiome plays a role. And it's one of the really nice things about scientific discovery is that the whole field will shift together. So, the dermatology knowledge of 20 years ago has really shifted. So the dermatologists of today has become much more refined in the way they gather research and the way they integrate research into their practice. As one of my mentees tells me, it's a great time to be alive.
Absolutely, it is. It's super exciting, and I'm glad that we're all on the same team together. Thank you so much for joining us, Dr. Sivamani. I really appreciate you joining us here, sharing what you know, and I look forward to having you back.
My pleasure.
I hope it was helpful to hear from a physician like Dr. Sivamani, who has tons of experience straddling the worlds between conventional and integrative dermatology. All of the things that we've discussed today can be found in the show notes over at skinterrupt.com/076. If you've got any questions, leave your questions and comments over there so we can continue the conversation. And of course, rate and review the podcast on your podcasting platform of choice. I deeply appreciate your support and your willingness to share what you love about the show. And last but not least, remember, sharing is caring, right? That's what I always say, and it's important. If we're truly committed to supporting everyone in our community, the best way to do that is to freely share the information that we find with others who may be seeking it out as well. In the meantime, I want to thank you so much for tuning in, and I look forward to seeing you in the next episode.